Okay, hello. I am Miss Alexander, Professor Alexander, and I am going to show you how to do your HEENT demonstration. So the first thing we're going to do is, as we enter our room, we're going to identify ourselves, identify our client with 2 patient identifiers, wash our hands, put on our gloves, provide for privacy, and make sure the scene is safe or provide patient safety. So I've already completed that task, and I'm going to move on now to assessing my patient. Can you please give me your name?
My name is Patrick Fuller.
Patrick, can you sit upright for me, please? Okay. All right, so we want our patient sitting upright because I want to have a good visual of his head. Now, what I'm doing now is I'm just examining or inspecting the head size, shape, and symmetry. His head is normocephalic, which means it is normal for the size of his body shape and width of his shoulders. Okay, I do not see any deformities noted at this time, and I do not see any muscle tremors or twitching. Okay, now Patrick, is it okay if I touch you? The next thing I'm going to do is just start it by inspecting the head by moving around to the back, and I'm just looking at his hair. Okay, his hair at this point looks well distributed. It looks clean, and I don't see any balding areas. Okay, then I'm going to palpate. I'm going to palpate the scalp. Any tenderness or pain?
No, ma'am.
No. How the hair again is well distributed. And I do not see any lesions. I do not feel any bumps or lumps or deformities. Okay. So the next thing I'm going to do is I'm going to move to his eyes. All right, so I'm going to come to the front. And again, I'm assessing hair distribution. I'm looking at his eyebrows. His eyebrows are thick and well distributed. I don't see any problems with balding in the eyebrows or eyelashes. Has very nice eyelashes here. Okay, looking at the tissue around the eye now. I don't see any edema, any redness, or any lesions on the external orbita. Okay. Patrick, can you look at me? Now I'm looking at his sclera. His sclera is nice and white. I don't see any redness, any discharge, any jaundice. Patrick, can you pull your eyelids down? And now I'm going to take a look at the conjunctiva inside. It looks pink and moist. I don't see any lesions, redness, or drainage from that area either. Thank you. Okay. So the next step after we do our inspection is to make sure that we have good pupillary reaction. All right. I'm looking at the pupils, and Patrick, look right here at my nose for me. And his pupils are equal and round. I don't see any deformities on either eye, so that tells me he's not had any eye surgeries. Okay, and I'm going to shine a light into your eye. I want you to keep looking right here. I'm going to start with his right eye, and I'm looking for pupillary constriction, and it constricts briskly. I'm going to go to the left eye, and it constricts briskly. Now I'm going to look for consensual relationship between the 2 eyes. I want to make sure he's neurologically intact. So keep looking at me. And this eye constricts, and the right eye constricts. His eyes are working together, so they have a consensual relationship. Okay. The next thing I'm going to do is, Patrick, keep looking at me, and I want you to look at this pen light here. I want you to follow this pen light in. Okay, so I'm going to have him watch the pen light, and I'm looking for pupillary constriction and pupillary dilation. And he has brisk constriction and dilation on accommodation. So his eyes are perla. Pupils are equal, round, reactive to light and accommodation. The last thing I'm going to do is test Patrick's ocular muscles. Okay. So what I'm going to have you do now, Pat, is to look at the pen light and follow just with your eyes. Okay, so here we go. And now I'm looking for any kind of tremor or nystagmus. And full range of motion through each of the 6 cardinal gazes. And I do not see any tremor or nystagmus, and he moves fully through the range of motion at this time. All right. Now I'm going to move down his face, okay? Instead of going to his ears next, I'm going to actually do his nose, then his mouth, then his ears. Okay, so I'm just looking, nose is midline. I do not see any external nasal deviation. Patrick, can you look up for me? Now I'm looking at the septum here, and I'm making sure that it's midline also. I don't see any nasal deviation, but I'm going to take my pen light just to make sure. And I'm looking up inside the nostrils. No nasal deviation. You can look back down. I did not see any lesions, any drainage, or any excess mucosal edema. All right. Now, is it okay if I touch you?
Mm-hmm.
Okay. So, as I move forward here, I'm just going to palpate the bridge of Patrick's nose. So I'm going to start at the canthus of the eye here, and I'm just going to lightly rub in a circular motion. Any tenderness or pain?
No.
No. Next, I'm going to palpate the frontal sinuses. Any tenderness or pain?
No, ma'am.
Any tenderness or pain?
No, ma'am.
Okay. Now I'm going to palpate the maxillary sinuses. I'm going to start at the canthus again, work my way out. Any tenderness or pain?
No, ma'am.
Okay, good. Perfect. So at this point, I don't see any problems with Patrick's eyes or nose or head. We're going to move down to his mouth now, and on inspection, I'm looking at his lips. His lips look symmetrical. I don't see any deformities. They're within his ethnic background. No dryness, okay, and no lesions, no swelling. Patrick, can you smile for me? Okay, I want to see your teeth and your gums if you can smile big. Good. So Patrick's teeth are nice and clean. I don't see any dental caries. Okay, and if you can pull your lip down for me. Good. And now I'm looking at the inner lip, the mucosa, and it is pink and moist. No lesions, no redness, no edema. Okay. The next thing I'm going to have you do, Patrick, is open up and say ah for me. As he sticks his tongue out, I'm looking at the tongue. I'm looking for any kind of lesions, redness, edema, or candidiasis or mucus on the tongue. His tongue looks nice and clean. It is pink. It is moist. That means he's hydrated. The mucosa on the inner cheeks, I do not see any lesions or redness or edema. Okay? Now, when I say ah, or tell you to say ah for me. Okay? Stick your tongue out. Say ah.
Ah.
Okay, his uvula rises and falls with pronation. Tonsils are a +1 with no exudate, no redness, and no edema. You can put your tongue back in. His tongue was midline. He's able to move it from left to right and touch the roof of his mouth. We didn't do all that, but that's okay. Okay, so now, once we've completed the mouth, we're going to move on to the ears, okay? So I'm going to move around here, and I'm just going to describe what I'm seeing. His ears are midline, right? Symmetrical on both sides. One's not higher or lower than the other. I don't see any missing pieces of the pinna. So he has all of his skin is intact here. No redness, no lesions, no edema on both sides. He does have ear piercings. So when the person has ear piercings, just note, take a look at it and make sure there's no edema, redness, or drainage from that or any crusting around that ear site. You're going to look at both sides. Okay, perfect. So ears on the external part are intact. The next thing I'm going to do is, let me come to this side so you can see what I'm doing. All right. So here, I am going to pull up and back for an adult. Okay. So I'm going to grab the pinna of the ear, just pull up and back slightly, any pain or discomfort.
No, ma'am.
And I'm going to take a look in to the inner ear canal. What I am looking for is redness, excess cerumen, lesions, or any edema. I do not see any of that. Okay? Now, I'm just gonna push right here on the tragus, any pain or tenderness.
No, ma'am.
No, good. So at this time, Patrick's ears are without any pain or tenderness. I don't see any excess cerumen or problems, but I want to test his hearing. So I'm going to step behind him. And Patrick, when I create a noise, please raise your hand to the side you hear the noise on.
Yes, ma'am.
Okay? So, all right. Okay. Perfect. So Patrick's gross hearing is intact. Good. All right, the next thing we're going to do is we're going to do the neck. That's our last section, right? So we've covered the head, the eyes, the nose, the mouth, and the ears. Let's test his range of motion and his strength first. So Patrick, what I want you to do is look straight up, okay? Down and touch your chin to your chest. All right, and look back up for me. Look to the right, look to the left. Did you have any pain or discomfort during those movements?
No, ma'am.
Okay, I did not see any muscle tremors or any weakness when he was moving through those range of motion, so I would say the full range of motion is intact. All right, the next thing I'm going to do is kind of see how much strength you have, okay? So using the back of my hand, the dorsal part of my hand, push against me. Good. All right. And again, push against me. Good. And now I'm going to step behind Patrick and place my hands on you and push against me. Shrug up. Good. All right. So Patrick's strength is full. I would say a 5 out of 5 because he has full range of motion and full strength to his neck. All right. So once we've completed the range of motion and strength, I'm just looking at Patrick now. And I'm looking at trachea, looking at his neck. His neck is midline between the shoulders. It's not deviated from left to right. I don't see any goiter or swollen tissue in the neck area. I don't see any lesions or striations or vessels. Okay, so after I look at that, Patrick, just look up slightly for me. Now, trachea is midline. It's not deviating from right to left. Is it okay if I touch your neck? Okay. When we check for thyroid, we're going to put 2 fingers on one side of the neck, the thumb on the other, have them tilt their chin down. All right, and swallow. Good. Patrick does not have any inflamed thyroid or enlarged nodules or thyroid tissue at this time. Okay. So after assessing or inspecting the neck, and we're looking for those items, we're going to palpate for thyroid tissue. Then we're going to palpate for the lymph nodes. Here's the fun part. So I'm going to have Patrick just turn just slightly so that you can see the back of his head. And I'm going to start palpating from the back because this is just how I do it. So right here on the base of the skull, the occipital nodes, we're going in a circular pattern. I do not feel any nodes. Posterior cervical. Okay, I'm going to come around to the front. Look up for me. Just above the clavicle, I'm going to start from the outside in, circular motion. And I do not feel any nodes or palpable nodes at this time. Then I'm going to grab his neck again, anterior cervical nodes. Okay. Tonsillar nodes, submandibular nodes, submental, preauricle, and postauricle. At this time, Patrick does not have any swollen or palpable nodes. Patrick, are you comfortable?
Yes, ma'am.
Okay. Is there anything that I can get for you?
No.
No? Okay. So if your patient's comfortable and they do not need anything, make sure that you give them back their cell phone, their call light, or their access to you. I'm going to go give the physician the findings, and he will be in to talk to you shortly.
Okay.
I'm going to over to the sink, take my gloves off, wash my hands, uncover privacy, and exit the room. Thank you.